Let's begin with a question that's left over from last week that we didn't get to it. We had a viewer who thought that we didn't address it in enough detail, but concerns about burnout on nursing staff and the need for additional resources there. This viewer is concerned there's not enough staff and that the compensation needs to be increased, and that this viewer, he or she, thinks that this should be a priority in this session. So let's talk a little bit about that. That's certainly a Department of Health and Human Services issue. Yeah. Big topic. Should we start with you, Representative Backer? What do you think?
Well, one of the things that really concerns me, I do a weekly video update, and last week we had quite a few, and you guys probably did at the Senate, leading age in. And what really disturbed me is with our governor's budget, his budget proposes a 20% decrease in nursing homes. And that is really disturbing, considering one of the things when us GOP rural members switched the House over to GOP in 2015, that was our #1 campaign, and we really fought for that. And what that did was it helped, like the viewer talked about, it helped with health insurance for the individuals. I serve as a volunteer EMT for our community. I've done it for 24 years. So we pick up patients at our local nursing home, and you could just see that year how the spirits raised with everybody, because, you know, they were not getting what they really deserve. So that just, I would agree with the caller. That concerns me that our budget our governor is proposing a 20% decrease. We need to keep it as is, or even help, because they help our seniors. Our seniors is who paved the way for us right now.
Senator Hoffman?
There was in 2015, I remember that conversation, and we had nursing homes say thank you. I mean,
Yep.
they were able to raise enough. I think $15 an hour is what they were finally able to start to pay some of the CNAs and the PCAs and some of the aides that were within the nursing home. Two things happened. The rate methodology conversation about how we get the money from the federal government in order to pay the staff is a contentious one, because the reimbursement rates are less, right, than if somebody went to work for a private organization across the street and worked in a clinic. They get paid a heck of a lot more. Mark and I have been on this conversation for the last 2.5 years about everything, and so have you, Jeff, on that. And it's like, here's the thing that gets me. In Minnesota, we now have 1 million people that are over the age of 65, right? Mm-hmm. It's the first time in the history of this state that we have more people 65 and older than we do in a K-12 education system. Yet, we see our priorities don't exercise with where our aging population is, and we need to make sure that that's there. Having said that, where do you get the revenue? How do you get the revenue? How do you find the savings? How do you do that? I mean, it's the same thing that we've been talking about. But she's absolutely right. There is a nursing staff burnout because there is not enough people to go around to find the job. And some of the work that you're doing is hard. We know that when you talk about some of the behavioral stuff. We got some of the day-to-day cares that are in there. And you know that as well as I do, Mark. I mean, we heard those stories about, you know, a mom who had been left in the bed for days because nobody was there, and they had no staff at night, right?
A PCA who doesn't show up and doesn't get out of bed for a weekend.
Yep.
And it's critical. And so Senator Hoffman and myself, my wife happens to do in-home hospice care. And so when you look at, even though I'm not on one of the committees, it's vital. When you look at the aging population, our nursing homes, our disability group homes, all the services, the PCAs, I'm focused on the impact. The financial piece is one aspect, and we look at, there isn't enough money to pay them, and we've stripped billions of dollars out of that provider network, but we didn't strip government dollars out of it. You know, the financial shift that we've spent in the last 40 years redirecting loved ones' assets away from their latter year care, it's really hurt it really bad. And so, but I also look at, I'm a process guy, and so my background lends to what's government doing and what's our impact? The rules and the process which the Department of Human Services has imposed is equally as damaging as the financial limitations that we put on. These are jobs of passion, right, and compassion. You can't train what they do in those jobs. My wife is one of them, but yet we've removed their hands. Our licensing, the regulatory components of it really have an impact on our ability to serve. And so today, Senator Hoffman and myself, we talk all the time. I think we've done a poor job as a society to prepare for our end-of-life mortality, and I think it carries over into the elder care. Look at the number of abuse and complaints and all those things coming through. We're not prepared individually to manage one's critical care, end-of-life care when it matters. And I think we need a cultural shift to bring multi-generational families back into the norm. Because we will not have the staff available. Even if we had all the money in the world, we will not have the staff available to take care of your loved ones. And so it affects planning, zoning, granny pads and all of those types of things.
Hey, that was my bill.
And we don't have
Granny
40
pads,
years.
was
Yeah, we don't have 40
Just
years
call
to
it
get
the
there.
Granny Hoffman.
Granny Hoffman?
Yeah, Granny Hoffman.
You know, go with that, Barry, too. And 1 in 5 people in Minnesota live with a disability, right?
Yeah.
1 in 10, it's chronic.
Yeah.
And as our aging population gets there, that's only going to be happening.
Exacerbated.
Here's what bothers me, too, is DHS has not been planning for the 65 and older with people with disabilities. And Senator Abler, just the other day, it was almost like, seriously? He went and met with them, and it's like, okay, so if we have to take the lead in this, then let's go ahead and take the lead in that. So I'm coming back saying I'm going to keep working at this, and I know you're.
We are not giving up.
We are not
There's
giving
no
up
way.
on this, Barry, because it's right in front of you. It's right in front of you, right?
I know this, we had this discussion, I serve on HHS policy, but also we need to have a bigger discussion on really how we look at our health care. Because what we do is, I see this as an EMT, we focus on the problem instead of, and one of the things I've done is I've purposely sat down, reached out to several of the new freshmen Democrats and say, hey, what are some of the important issues? And 2 of them, which are both doctors, Representative Ellison from Edina and then Representative Mann, we really got into this, especially with Representative Mann, got into discussion, what can we do to change the culture of people being more healthy? Because a lot of things that we solve could be prevented. I see that as an EMT. So I know that's a little strain from that, but that comes if we're healthier and we put less strain on the system. But that is a culture change because as we are living longer, we want to live also healthier instead of, well, if we have this problem, a heart attack or a stroke, we put tons of resources in. Let's look at ways to prevent it.
I'm thinking that healthier lifestyle has negative implications for my Cheetos affliction. Is that correct? I mean, I thought you have to give those
Yeah.
never mind. So I want
If you say so, Barry, okay?
That's right. All right.
Okay,
I wanna
we'll
go-
vote on it.
Cheetos, I like that
I want to go back to
Pringles.
Pringles. There you go. There was that too. I want to go back to the granny thing, the
Yeah.
granny pad thing, and just this is not an issue we want to spend much time talking about. But as I recall that bill, it involved giving some people some flexibility to have living units, and of course the city's opposed it.
Oh.
It was, and so is it a dead? Is it dead or is it?
It's in law, Barry, it's still in law that it allows it, but we because of the concessions, the League of Minnesota Cities, they wanted to let cities opt in or opt out of it, and they gave it a pretty short timeline, and most cities, I'd say probably 100% of the cities, opted out, but those that were already doing it found that it was important. Not only was it cheaper to be able to have that little tiny home in your driveway or wherever you wanted to do it, but then grandma was there and the grandkids were there, and it was like that whole thing about you talk about multi-generational. This made sense. They're doing it in Portland. It was like, why can't we do it in Minnesota? Matter of fact, Tori.
You think about the value of that multi-generational
Yeah.
life
Oh, huge.
with your grandchildren. My children got to spend 5 days a week with their great-grandmother prior to school until they're 12 years old. Most don't get to spend that quality of time, but we need to get it back, and we don't have a short time. And so what do? We don't come back collectively as a society after school. We have to do that, and we need to prepare people because we need you to take care of your loved one for as long as possible. We're only going to have enough resources for those that don't have that alternative, and for those families where they finally reached a point where they can no longer provide care. It's safe in a home, if it's a dementia or Alzheimer's case where the home is no longer a safe environment. But we need to do that. But we don't have 40 years to revert back. 10 is going to be a time frame that our lives will change
And
pretty
the
dramatically.
cost. I mean, when you look at, all of a sudden, the person's at home, and we knew this in our studies of people with disabilities that were living in state institutions. Get them to live in the community. Not only is it cheaper, people are living longer, and the quality of life goes there, and it just made perfect sense. I would love to see this open up again, Barry.